Hello, everyone. It's Eric from Strong Medicine. For those of you who are new here, welcome. I'm a hospitalist that is an internal medicine doctor who specializes in the care of hospitalized patients. Today, I'm discussing the recent White House memorandum describing Donald Trump's annual physical exam. Now, I have not personally examined Mr. Trump, and as a general rule, it's problematic for a physician to speak too specifically about the health of a public figure who they've not interviewed or examined. So I'm not going to be making or refuting any specific diagnoses here, but instead we'll be going through this 3-page letter section by section to discuss what his medical team did, whether or not it was indicated, whether or not the details are believable, and what the general takeaway should be. This is nothing against Trump's current position personally, but because of absurd statements made by his physicians in the past, this letter should not be blindly accepted at face value. For example, there was this 2015 letter from Dr. Harold Bornstein, a private GI doctor from New York City, that claimed his laboratory tests were, quote, astonishingly excellent, and, quote, his physical strength and stamina are extraordinary, and that he would, quote, be the healthiest individual ever elected to the presidency. Really? As to why Mr. Trump is even getting a GI doctor to be the one making such claims when he reportedly has no GI problems, we can only speculate. But Bornstein did later claim in 2018 that Trump dictated the letter himself. And then in that same year, in 2018, head of the White House Medical Unit, Dr. Ronnie Jackson, reported the results of his recent exam of the president, claiming that Trump was in excellent health with no indication of any cognitive issues, having performed, quote, exceedingly well on his cognitive test. That cognitive test turned out to be the Montreal Cognitive Assessment, a quick screening test for dementia, with such brain teasers as how are a train and a bicycle similar, and what animal is this picture of? Shortly afterwards, Dr. Jackson found himself the center of attention when reports emerged that the medical unit routinely gave out sedatives and stimulants without a prescription, earning Jackson the nickname of Candyman. A 2021 investigation by the Department of Defense's Office of Inspector General determined that during his service under Trump, Jackson was repeatedly intoxicated on the job and sexually harassed subordinates. The point here is that while I will not be accusing any specific person of lying, it is prudent to be skeptical when it comes to officially released information about Trump's health. On April 11th, the president underwent his annual physical exam at the Walter Reed National Military Medical Center. Per media report, he was there for nearly 4 hours, which would be far from typical for the average patient, but given that he's the president and should undergo a much more thorough investigation, I don't think we should read anything into this. For comparison, Joe Biden's last comprehensive presidential exam in 2024 was 2.5 hours. So, same ballpark. Trump's 2025 exam was led by Captain Sean Barbabella, another emergency doctor. I don't know anything about Dr. Barbabella's competency, and this is not a personal dig at him, but it is an odd choice for presidents to be choosing an emergency medicine doc to effectively serve as their primary care provider, coordinating these annual exams. Now, certainly it makes sense for someone trained in trauma care to always be near the president, but this specific type of evaluation, it clearly falls into the domain of primary care, and I would strongly recommend someone from internal or family medicine do that. Anyway, before we even get to any data, Dr. Barbabella writes, I performed and supervised a comprehensive exam, which included diagnostic and laboratory testing, as well as consultations with 14 specialty consultants, all in accordance with U.S. Preventative Services Task Force recommendations. As a brief but relevant digression, what exactly is the U.S. Preventative Services Task Force? This is a standing panel of experts who develop recommendations on primary care based on the best available evidence. The panel is appointed by the Department of Health and Human Services. They've been around since 1984 and are the gold standard when it comes to deciding what tests and preventative medications are effective and should be recommended to patients within the context of primary care. For better or worse, they explicitly do not consider cost in their recommendations, which will be relevant in a few minutes. Ironically, despite the shout out to the White House memorandum, despite the shout out in the White House memorandum here, the USPSTF is now threatened by RFK Jr.'s slash and burn approach to reducing his department's scope and workforce. Notably, within the USPSTF's recommendations, there is nothing that would suggest the need for 14 specialists in Mr. Trump's case, particularly if he truly is as healthy as he claims. In addition to a PCP, he would really just need a gastroenterologist for his screening colonoscopy. If the president was a woman, depending on the PCP skill set, she might otherwise also need a gynecologist for a pelvic exam and pap smear if there was a reason she was at an increased risk of cervical cancer. But a decent PCP could really do everything else themselves. Now, Trump is the president, so having 14 other docs weigh in on his health might be appropriate, but it's very misleading to state that this was in accordance with USPSTF recommendations. Now, on to the actual exam. A lot of online discussion has already mocked the combination of his height and weight of 6 foot 3 inches and 224 pounds. For our friends across the pond, this is 190.5 centimeters and 16 stone on the dot. This is a body mass index of 28.0. I'm not going to break out photographs of Trump standing next to other people of known height to estimate his actual height, but this is very obviously not the body habitus of someone with a BMI of 28. As to whether it's his height or his weight that's inaccurately reported or both, I don't know, but at least one of those numbers is. And for the record, I'm not advocating for the use of BMI as a great metric for obesity. Also visibly across many pictures and video, I will say Trump does look like he's lost a little weight in the last few years, which was also has been reported as well. Next are his vital signs. His resting heart rate was 62, blood pressure 128/74, pulse oximetry of 99%, and temperature of 98.6. For anyone not familiar with the pulse oximetry, this refers to the percentage of hemoglobin in arterial blood that is fully saturated with oxygen. Individually, each of these numbers is completely believable, but I am a little skeptical because of how all four of them look perfect. While I have seen surprisingly normal heart rates and blood pressures in older obese patients not on antihypertensives before, I would not say it is typical. Less obvious is the fact that a pulse ox that high is also not typical at his age. As people age, gas exchange within the lungs naturally worsens. On a physiological level, what happens is an increase in the alveolar arterial gradient caused by worsening of VQ mismatch. So while it's very possible for a 78-year-old to have an O2 sat of 99%, 94 to 97 would be more typical. And as regular viewers of this channel may remember, normal body temperature actually is not 98.6, but instead is about 1 degree Fahrenheit lower than this, and even more so, a little bit, in the elderly. So again, while no one single vital sign stands out as unbelievable, the combination of all four make me just a little skeptical. This is even more so since they are listed after the clearly inaccurate height and or weight. Next is the remainder of his physical exam. Overall, this is a slightly more robust exam than typically indicated for a routine health check, but nothing here that stands out as strange per se, at least as a part of physical exam. Now, the med school professor in me is more than a little annoyed that Dr. Barbabella is embedding historical diagnostic test results within the body of the physical exam. To trainees out there watching this, please don't do that. Now, some of those diagnostic tests are also of questionable value. The USPSTF specifically gives screening carotid ultrasounds in asymptomatic patients a grade D recommendation, meaning that there is sufficient evidence to say that it is not an effective thing to do. The USPSTF only recommends screening chest CTs in current or past smokers between the ages of 50 and 80, while Trump is a lifelong non-smoker. And they don't even bother with a recommendation for screening echocardiograms in asymptomatic people without suspected heart disease because it's so clearly not indicated. Keep in mind, as I said before, the USPSTF does not consider cost when making recommendations. So it's not a case where they don't recommend these tests in general because it would be too expensive to implement at a population level. They don't recommend them because there is not sufficient evidence of benefit, irrespective of cost. A test doesn't magically become more effective when performed on a president, which goes back to Dr. Barbara Bell's initial claim that everything was in accordance with USPSTF recommendations. In contrast, the mention of a follow-up colonoscopy 3 years after a benign polyp was seen in 2024, that does seem totally reasonable. I'd like to spend just a moment on the neurological exam. There has been no shortage of commentary over the years about Trump's neurologic function. For example, there are online clips of Trump seemingly having balance or coordination issues. But he is also filmed on camera more than any other person in history, and these easily could have been one-off incidents, not indicative of a long-standing chronic condition. Who among us has not at some point dropped something or tripped on our own feet? So I can actually believe that his sensory motor coordination and reflex testing, as would be done during a normal physical exam, actually was all normal. Regarding cognitive testing, as already implied, the Montreal Cognitive Assessment that he underwent is not difficult. Would I predict that Trump would truly score 30 out of 30 when the test was administered by an objective, independent clinician? No, I would not, but it doesn't make a perfect score for him implausible. Now, I do have a previous video on this channel from the fall that discussed Trump's unusual speech and thought pattern and how I did not think that Trump was or is neurocognitively normal. But in that video, I also discussed that these observations are not consistent with dementia per se, and nothing I've seen or heard him say since changes that. Now we move on to the lab tests. His cholesterol panel does look fantastic, but he is also on 2 cholesterol medications, so that would be expected. His complete blood count is unremarkable, and also totally consistent with his age and stated medical history. Regarding his, quote, metabolic panel, to put on my medical school professor hat again, some of these tests are not conventionally considered part of the metabolic panel. It feels strange that a physician would have framed it in this way, even if for a layperson audience. So it does stick out a little bit. Regarding the values themselves, the only thing among the values that sticks out is the PSA. PSA stands for prostate-specific antigen. It's an enzyme that's secreted by the prostate gland, and despite its name, it is actually not 100% specific for the prostate, as it's also produced in much smaller amounts in women. The PSA is used as a screening test for prostate cancer, though a highly imperfect one, and there's reasonable debate as to whether or not men of average prostate cancer risk should even get one periodically checked. In fact, the USPSTF gives checking PSA in a man over 70 another grade D recommendation, meaning we should not be doing it in the absence of a personal history of prostate cancer. But what stands out with Trump's value is that it's so low. PSA naturally increases with age. One of the many reasons it's a poor screening test is that most older men with enlarged but non-cancerous prostates have PSA values that are above the upper limit of normal. I'm not a urologist, but I cannot remember ever seeing an elderly man with a PSA of 0.1 who had not undergone an invasive procedure to treat prostate cancer. I'm not saying that Trump has or had prostate cancer. It's just that value sticks out among the blood tests as suspect, and the fact it was even checked at all is unusual. There's comparatively not much to say about his past medical and surgical history. High cholesterol and seasonal allergies are very common. Rosacea is a common skin condition that results in redness of his face, sometimes mistaken for acne. Actinic keratoses are small, rough patches on the skin caused by sun exposure, also super common in the elderly. And diverticulosis refers to small outpouchings of the wall of the colon, which can either bleed or become infected, but which are asymptomatic in most people. Regarding his current medications, the use of aspirin for primary prevention of cardiovascular disease in the elderly, which was previously commonplace throughout the 80s and 90s and early 2000s, now also gets a grade D recommendation from the USPSTF. It's not a huge error on the part of his doctors. There are plenty of doctors that still do this, but it is another example of them not adhering to guidelines. unless Trump's personal medical history has more to it than he has disclosed, such as a prior heart attack, stroke, or TAA. Again, I'm not speculating that's what happened. It would justify the aspirin use. Dr. Barbabella concludes, President Trump remains in excellent health, exhibiting robust cardiac, pulmonary, neurological, and general physical function. His active lifestyle continues to contribute significantly to his well-being. President Trump's days include participation in multiple meetings, public appearances, press availability, and frequent victories in golf events. President Trump exhibits cognitive and physical health and is fully fit to execute the duties of the commander-in-chief and head of state. So, in summary, Trump had a bunch of tests, some of which were not indicated, and I'm left with the impression that some pieces of information in the letter are either complete or plainly false. But the overall gist of the whole letter, Trump is physically fit enough to serve as president, seems more or less accurate, with a few big caveats. First, aside from the mocha, he otherwise did not undergo cognitive testing, so claiming he has excellent cognitive health in Barbabella's summary paragraph is at best unsupported. Another caveat is that because this letter contains at least one piece of false information, it suggests the possibility that major medical problems may have been omitted. Short of an illegal leak of his private medical records, there would be no way to know for sure. There are also several strong arguments that someone of his age should not be president, period, no matter how healthy he or she may be. However, having said all that, if we accept that there is currently no age limit to the presidency, we should not be expecting better physical fitness from a 78-year-old, even if characterizing his health as excellent, quote unquote, in this letter was a bit generous.